So any patient who is coming with hematuria, we have to ask certain questions to reach to the diagnosis or to make a good differential diagnosis. We have to ask the patient, okay, for how long you have this blood in your water work? This is the first time or you are having before also? Was it like, what is the color? Dark red or bright red? Okay. Okay, that's the next question will be, blood is coming at the beginning while you are passing the water work. If it is at the beginning, it is urethritis. If it is at the end of passing water work, then it is some problem either in the bladder, urinary bladder, or there is some problem in the prostate. But if the patient says, no, it is throughout, from the start till the end, it was red urine, red water work. So in that condition, the problem is in the kidneys. Okay, the next question should be, is it painful while you are passing this blood or it is painless? So if it is painful, then the differential diagnosis for painful hematuria is kidney stone, autosomal dominant polycystic kidney disease, autosomal dominant polycystic kidney disease. The third differential will be pyelonephritis. The next differential will be analgesic nephropathy leading to papillary necrosis. And then the next differential will be trauma. So these are the causes of painful hematuria: kidney stone, autosomal dominant polycystic kidney disease, pyelonephritis, analgesic nephropathy leading to papillary necrosis, and trauma. But if the patient says, no, it is not painful, it is painless hematuria. So in that condition, the differential diagnosis will be like this. First one, pulmonary renal syndrome. We can divide into ANCA positive and ANCA negative pulmonary renal syndrome. But most likely pulmonary renal syndrome in which there is hematuria and hemoptysis, both are there. We have to keep three differential in our mind. Granulomatosis with polyangiitis, the previous name is vaginous granulomatosis. The second one is rapidly progressive glomerulonephritis, that is anti-GBM antibody. And the third one is microscopic polyangiitis. The second one, anti-GBM antibody, is also known as Goodpaster's, previously Goodpaster syndrome. So pulmonary renal syndrome, in which the patient will be having hematuria also and hemoptysis also. Then if the patient is not having any hemoptysis, then we have to keep two differential in our mind: IgA nephropathy and post-streptococcal granulonephritis. And the third one you can put also HSP. Okay. Then we have to ask the patient, do you have any blood-related disorder running in your family? If there is positive family history for blood-related disorder, then we have to keep three differentials: hemophilia, von Willebrand disease, and hereditary hemorrhagic telangiectasia. Then the other possibility of painless hematuria will be bladder cell carcinoma or bladder carcinoma or renal cell carcinoma. And the last one is drugs leading to hematuria. That will be also painless. Patient on blood thinning medicine like warfarin, heparin, or other blood thinning medicines. So these are the questions that will help us to make the differential diagnosis and to help us to reach to the diagnosis. So again, going back to the history, start with onset, course, duration. When it is started, since it is started, it is improving or increasing or the same. Okay, how it is started, suddenly or gradually? Okay, is there any history of trauma or no? And the duration. Then progression, how it is progressed. Aggravating factor, relieving factor, associated symptoms, very important associated symptoms. So whenever you have any patient with some specific area is involved, try to do the associated symptoms of that area. So this is the same thing I informed to Dr. Vikas, that if the patient is giving you hematuria, so you have to ask the question related to urinary bladder, you have to ask the question related to kidneys also. So complete this area completely, then go to the other areas. Like if you are thinking about pulmonary, go to ask the question about the pulmonary, upper respiratory, lower respiratory. Then you have to ask the joint pain, eye redness, rashes, weather preferences maybe, or weight change is very important. Anemia symptoms very important. The patient is having hematuria or hemoptysis, we should ask the anemia symptoms, questions related to anemia. And then soreness into the mouth or into the private area. Okay. Yes. Then the past medical history, drug history, family history, social history, all very important to complete the approach for hematuria case.
For more detailed explanations and related topics, we invite you to watch our videos on our YouTube channel. Don't forget to like, comment, and subscribe to stay updated with our latest educational content. Thank you.